Welcome to On the Beat, everyone. I'm over here with Dr. Alan Pritchard and Office Administrator Jana Steele from Plastic Surgery of North Mississippi. And today, ladies, it's all about the breast augmentation. How are you?
It's good to see you.
Nice to see you again. Okay, now we are talking about breast augmentation, and I want everyone to know, a lot of people talk about it. We seem to think that we know a lot about it, right? Because it is on the tip of everyone's tongue that at some point or another that they've considered it or they know someone who's had it done, right?
Right.
Okay. Let's explain to everyone at home the difference with breast augmentations. There's implants, there's lifts, there's natural implants. Let's just break it down a bit, can we?
Oh, very simple. If we have a patient comes in and she doesn't have a lot of breast tissue,
yes.
Well, she's not going to drop from having children. So a breast augmentation is perfect for her.
Yes.
One, it gives her volume and projection. And the two things you want out of this is to feel your clothes out better and feel better about yourself. Okay. Now, if you come in and say you're I'll just use the words a size C or a size D, then maybe a lift is all you need. You don't need any larger than what you have. You just want to get them back up where they were.
More youthful.
Yeah, more youthful. Yeah, that's more perky.
Yeah, and I think a lot of ladies do consider having this done after they've had babies.
Correct.
They've done with the babies, no more, and they think, okay, now I need to rejuvenate again.
This is the number one question I ask. Are you finished with the children?
Well, before we get to that part, I want to bring you into the conversation, if I may, Jana. What is your role? Because people at home are thinking, okay, why would an office administrator be involved in this conversation? What is your role with the doctor and the patient when they come in for surgeries?
Well, I go in after Dr. Pritchard has talked to them, and we just make sure that we are all on the same page of what everybody wants.
Right.
And make sure that I give them the details that they need in order to follow through with what they want.
Okay, so you're talking with the nurses, you're talking with the doctor, and you're discussing everything from prep, what they need to do beforehand, what they need to do post-recovery as well.
Prior and after.
Okay.
Yes.
Very huge support. They do a lot of it.
Yeah, and that's super important as well. Alrighty, let's talk a little bit about, you were touched on if you've finished having babies. Is there a misconception still out there that you shouldn't be breastfeeding if you have implants?
Yeah, it's sort of misconception. There's been no proof that that's going to make an issue with the baby's growth or anything.
Okay.
So I tend not to focus on that too much.
All right, what about breast screening for breast cancer?
Oh, family history is looked at.
Yes.
And if it's a very tight family history, I'll ask them to please go get a mammogram. Now then, even their doctor may not want to do it, but I'll ask them to and help them get it.
Okay.
You know, but it's usually the 35 to 40 category.
And usually, you know, when I go in to talk to them, I always ask, when's the last time you had a mammogram? Do you need an update on your mammogram?
Would you be suggesting you do that before the implant?
Before.
Okay. Does it blur the screening if you've already had implants? Because that was a misconception. Well, women who have breast implants shouldn't, you can't see the breast tissue properly.
No, all the radiology now is so progressed that they can, as long as you tell them you've had implants, they can adjust the machine to get a perfect view of the breast.
Okay.
And the implants are there, but they're not obstructing anything.
What are you telling patients for downtime after an implant's been done?
Well, my thing is, and she may agree with me, is it's always, hey doctor, how long is it be? Can I do what I want to do with some precautions? And it's always 10 days. Okay. You know, and I say if you can take a week off, great. If you're going to do it on Friday and go back Monday, boy, what do you do for a living? And I've got to have to tell you what you can and can't do.
Well, we appreciate both of you coming in.
Sure, no problem.
Thank you so much. If you want to find out more information about plastic surgery of North Mississippi and you just want to have a consultation, give them a call. Maybe you are the perfect candidate to have a breast augmentation. Back after this short break.